I'd like to announce the beginning of the second Health Policy Decision Makers Forum Asia Pacific meeting.
This forum, as you very are aware of, has been organized by the Fudan University School of Public Health in close conjunction with the Institute of Health Economics and Management, Asia Pacific at ESSEC Business School.
The willingness to pay for some innovations, and that's an important issue, may be lower in some disease areas or some health program areas than others. All countries have to consider that investing in innovation in their countries is important and will contribute to their economic growth. Not only will it contribute to their economic growth, but it will also contribute to the excellence of their healthcare system.
And making healthcare easier for the provider. And here, I take provider not just as the doctor or the nurse, but the community health worker, even the patient himself or herself, because self-care often may be the best care.
So we find out then our main problems, the root of all the other problems coming from these low financings, because the government priority so far is not in the healthcare. Their priority so far is economic growth.
For all of us, Asia is not whether or not we can afford to invest in healthcare, but to think about whether or not we can afford not to invest in healthcare.
Most of the health priorities are actually very influenced by lifestyle and behavior. It's really, being sure that actually those drugs are affordable for the different population in a similar country.
I think it's the role of academics and public health authorities, yes, I would say to quantify and to identify where burden of disease is particularly high, for what subpopulation and what target, because it allows you to identify where you should find solutions, and that's helpful for industry. I think we've learned that.
So I will thank you all speakers, participants for this forum.